Hi, I'm Pamela D. Wilson. If you are with me, you are here for Module 6 of Stay at Home, Creating a Plan for Loved Ones with Memory Loss. I'll do a quick introduction and you'll see me pop in and pop out of the slides so that you know that I am here and it is just not some voice talking at you throughout this webinar program. I'm going to begin the slideshow and turn off my video camera. Here we go. So, Module 6, Creating a Plan for Loved Ones with Memory Loss. We're going to talk about early indications, progression, and recognizing signs of memory loss, and in this part, how midlife health affects cognition. But first, let's do some housekeeping. I do this at the beginning of every program. If you've heard this before, bear with me. I will be brief. Throughout this module, you'll hear me use the terms elderly parent or elderly parents. You can substitute that term with spouse, husband, wife, partner, grandparent, friend, or the term that you use for the person who receives care. The outline for this module is in the materials for the online program. If you are here, your workplace may offer digital and other caregiving support programs for you as a working caregiver. Many caregivers come here to manage through the aspects of being a caregiver and working and caring for yourself and your family. If you're taking this program individually or on your own, congratulations on being proactive and interesting and learning more about caring for an elderly parent and caring for yourself. For us caregivers, taking care of ourselves is so important. Let's start by talking about the objectives of this program called Creating a Plan for Loved Ones with Memory Loss. At the end of this program, you should be able to recognize how midlife health affects cognition, identify steps to diagnosing memory loss, initiate conversations about dementia and memory loss within your family so that you can support short and long-term care planning, and also learn and adopt new approaches to respond positively to the changes that occur in elderly parents diagnosed with dementia. There are a series of webinars in this program. Go through them one at a time, come back, watch them again. I encourage you to make notes. So in this segment particularly, we are going to be talking about midlife health and how it affects cognition. So for this part, the goal is that you should be able to understand how health in midlife, so anywhere from 30 all the way up, affects cognition and memory as we age. I want you also to be able to think about and identify health conditions of your elderly parents and conditions that you might have in midlife that can contribute to memory loss and other chronic diseases. The question I like to start with is, how does midlife health affect cognition? There are research studies that indicate that changes in the brain and cognitive decline begins as much as 20 years before a diagnosis of mild cognitive impairment, dementia, or Alzheimer's disease. Cognitive declines related to memory are connected to chronic disease. Our midlife, our middle years, anywhere from 30 to 50 to 60, is the time when most of us will have more than one chronic disease, like heart disease, diabetes, COPD, asthma, arthritis. Midlife is also the time when neurodegenerative diseases begin to appear. Neurodegenerative disease, it's an umbrella term that means a range of conditions that start to affect how our brains work. Memory loss, dementia, Alzheimer's, they are all brain diseases. And Alzheimer's represents 60 to 70% of dementia cases. Let's talk about the most common types of dementia. Alzheimer's and vascular dementia that we'll talk about in detail are the two most common subtypes of dementia. Increases in the diagnosis of dementia normally, and I say normally, begin at the age of 65, with about 50% of people age 80 and older having the diagnosis. And I do use the term normally because as we go through this program, you'll hear me talk about early onset dementia, which can happen as early as age 30. I want to talk about Helen's story, and I'm going to turn on my video camera so that you can see me down here. So Helen is a client of mine who was married. And when I became involved, it was because her husband was overwhelmed with having to take care of Helen. They had probably, I want to say 3 or 4 children who were very devoted, but they worked, they had their own jobs, they couldn't be there all the time. And the husband was very unfamiliar with Alzheimer's. He hadn't gone to a lot of educational programs. She would have behaviors and he wouldn't know how to react. In talking to him about Helen and how her diagnosis of Alzheimer's came about, it was a very interesting story. This story mirrors the research that indicates that memory loss, Alzheimer's, dementia, begins in very small stages, anywhere from 10 to 20 years before that diagnosis. So Helen was diagnosed with Alzheimer's disease, and she started to experience changes in what we call executive function and working memory skills. And I'll explain this. One of the things that Helen did for years was to write, create, and distribute the church newsletter for their church. Her husband noticed about 10 years before her diagnosis that she started to have problems with this task that she could do in her sleep. She would get the newsletter put together, she would send it out, she would respond to people. It was so easy for her. Little bits and pieces started to happen over time. Helen would have difficulty typing the newsletter. Or she would turn the computer on and there would be some kind of a glitch and she would have to go get her husband to help with something that went wrong with the computer. Then as time progressed, the newsletter dates were missed. It would start going out late. Or there would be a lot of typographical errors in that newsletter. The idea of executive function and working memory that we'll talk about are things that those of us who don't have memory loss or any cognitive problems, they're activities that we do in our sleep and we don't even think about. You know, you drive to work, you don't get lost, you wake up, you take a shower, make breakfast, maybe you take vitamins, you drop the kids off at school, you go to work. They're things that we do routinely that our brain just makes work. So I'm going to turn off my video. We're going to go to the next slide and continue and talk a little bit about executive function. So what exactly is executive function? Let's talk about it. So executive function skills relate to our ability to pay attention, to organize, to plan, to prioritize, to begin and finish a task. And executive function is also our internalized speech. It's the way that we talk to ourselves, like, oh, I have to remember to do this, or I goofed that up, or wow, I did really great at that. Executive function is also represented by verbal working memory, which is that ability I talked about with Helen to remember how to complete a task. In Helen's story, it related to creating, finalizing, proofreading, and distributing that newsletter. Other examples could be a recipe. Maybe you make a great spaghetti dinner and you do it without even thinking. You don't use a recipe book. You throw everything together and it turns out great. For older people who begin to have issues with verbal working memory, your mom or dad may all of a sudden forget how to create a recipe. Or maybe dad was great at mowing the lawn and all of a sudden he's having trouble with that lawnmower. These are problems that begin to happen. Chronic disease and modifiable risk factors are something very important to consider for all of us. I want to talk about how chronic disease progresses to states of memory loss. Higher vascular risk is linked to more trouble with our brains, even in adults who physically look healthy. This means that if you or an elderly parent have vascular risk factors that we'll talk about in a minute, you're more likely to have memory loss or Alzheimer's or dementia when you are older. Heart disease is a main vascular risk factor. The vascular system is also called the cardiovascular system. It circulates all the blood, the oxygen, all the nutrients that we get through eating, through our body. And to simplify this, what a vascular risk factor is something that relates to smoking, high blood pressure, a high pulse pressure. A high pulse pressure is the difference between the top number, which is systolic in a blood pressure reading, and that bottom number. The bottom number is called diastolic. A high pulse pressure is the difference between those two numbers. So it's high when the difference between the top number and the bottom number is more than 60. Pulse pressure can be high because we have high cholesterol, because we have fatty deposits that build up in our arteries. And if we want to add to the risks of vascular dementia and heart disease, let's add diabetes, high cholesterol, a high body mass index. Your doctor uses that as a screening tool to determine if you have excess weight that can lead to health problems. The good news about all of this is if you identify these conditions early, they're modifiable, which means that you can change them with your own actions. Exercise, diet, managing your weight, being more proactive about health. Our diagnoses do not have to lead to frailty and illness in old age. If they do, it's because we chose not to be proactive. I like to compare maintaining our bodies to maintaining a car. So if you think of a car and everything that keeps it running, all the fluids, oil, your radiator fluid, brake fluid, transmission fluid, power steering fluid, the air conditioning coolant, your windshield washer fluid, if any of those runs out or becomes dirty, your car doesn't run as well. Think of the vascular system or the cardiovascular system of the body in the same way. It clogs up from cholesterol, and anything that inhibits the blood flow can result in unexpected health problems. Also, drinking fluids is important, especially for older adults. Dehydration, meaning not enough fluids, is very common in older parents, and it can result in problems. Many elderly adults will go to the emergency room because they are dehydrated or they're not eating well enough, and they have a condition called delirium, which is mental confusion. Let's talk about ischemia because this relates to vascular problems. Ischemia, it's another medical speak term. I call all these medical words medical speak terms because doctors and healthcare professionals will use them, and most of us as consumers have no idea what they're talking about. So, what is ischemia? It's a lack of circulation or blood flow to any part of the body. Ischemia of the brain is a lack of blood flow through the arteries of the body and our blood vessels up to the brain. When blood flow to our brain is weak or clogged or long-term, this results in vascular dementia. The same type of ischemia, though, can result in other parts of our body and cause health risks. My mom, who I'll talk about in a moment, suffered ischemic attacks of her brain that result in mini strokes. And a medical speak term for a mini stroke is a TIA. I watched them happen with her. They came and they passed so quickly that if you didn't know what they were, you probably wouldn't notice it. It's kind of like a glitch in an electrical system. Because of my mom's health issues, her vascular system, her arteries, veins clogged from many, many years of chronic health conditions. So I want to introduce you to my mom, Rose, and I'm going to bring on the camera. So this is my mom, Rose. I don't know how many of you remember those beehive hairdos back in, gosh, probably the 70s and the 80s. My mom God bless her, was a lifelong smoker because when she grew up, she was born in 1926. And if you were in your 20s, 30s, 40s, smoking back then was a really cool thing to do. And many people smoked. She had a poor diet, but back then, we weren't really talking about what a poor diet was or what a good diet was. There was no differentiation between you should eat this and you should avoid these things. Because of the smoking and diet and not really being active, she had severe cardiovascular issues. And if you remember, cardiovascular issues are issues of the heart. From the time that I was young, in my teens, I remember her not feeling well, going to the doctor all of the time, being in and out of the hospital. When I was in my late teens and early 20s, when I had a car and I could drive, I was the child who got the phone call on Sunday night saying, "Can you come? Can you take me to the emergency room? I'm not feeling well." Her heart issues were so severe that by age 60, which in my opinion is young, she had to have quadruple bypass surgery. So 4 arteries to her heart were clogged so significantly that she was having almost daily issues with dizziness and not feeling well. 9 years later, she passed away. But during this time, she had severe gastrointestinal issues, and by that I mean stomach issues. So she burped, she was nauseated all the time, she had hiatal hernias, and I want to talk about this because I recently did a radio program that can provide some very helpful information that you might not be aware of. So let me turn the camera off and advance to the next slide. I do a radio show every Wednesday night that turns into podcasts. And this particular podcast is called Tired of Caring for Elderly Parents. The radio show is just one of the many fun and interesting projects that I am so blessed to create every week. If any of you smoke, this podcast features an interview with Dr. Brooks Cash. He's a very experienced gastroenterologist, currently working in Houston at the University of Texas Health Science Center and the McGovern School of Medicine. He was a Navy doctor for a long time, career Navy. In this podcast, he shares information that most consumers don't know about smoking, and he talks about the relation between smoking and digestive problems. If you or someone that you know smokes, this information can help you prevent health issues today and in the future. Because I will admit that when my mother was having all of these heart problems, her heart disease, her stomach issues, none of the doctors, while they did say her name was Rose, they would say, "Rosie, you should stop smoking. It's not good for you." And she eventually did. But none of them talked about the relationship between smoking and indigestion, smoking and what we call today GERD, which is gastro reflux disease. Smoking and hiatal hernias, smoking and irritable bowel syndrome. Nobody was talking about it back then, and I just don't know if we didn't know enough back then. Today, we know so much. So, what consumers don't know about smoking is in this podcast. I highly encourage you to go to my website to find it. Website is PamelaDWilson.com. Scroll to the media tab, look for the Caring Generation radio show, and look for this picture of the podcast. So the results of smoking and how this relates to ischemia is that individuals who smoke experience ischemia of blood vessels that cause plaque buildup in the arteries. This ischemia goes down to the stomach and other body parts. So as I talked about, people who smoke will experience chronic indigestion, irritable bowel syndrome, many other stomach conditions. Smoking also increases the risk of strokes, and strokes are caused by clogged blood vessels and clogged arteries. Let's talk about some age-related sensory concerns and cognitive function and how this happens. So as we age, there are indications of neurological changes in our brain, and these include a loss of hearing, changes in our vision, and changes in our smell. You would wonder why this happens and how it relates to our brain. Well, if you think about it, Our brain is in our head. Our hearing, our vision, and our smell are all senses that are close in location to that brain. Any one of these concerns is associated with worse cognitive function, with memory loss in middle-aged adults, beginning in middle-aged adults. And research confirms that all of these changes, hearing loss, vision, and smell, can be reflective of changes in the brain. However, they may not always result in a diagnosis of dementia. If you have vascular risks, like we talked about, the likelihood is higher that you will have dementia when you age. So let's summarize the information that we just talked about. For all of us being a caregiver, we can see changes in our health early in life if we pay attention. The benefit is that we have the opportunity to seek regular medical care by going to annual doctor appointments, receiving preventative care. All of those can help prevent cognitive diagnoses later in life, but we do have to be proactive. I know many people don't like to go to the doctor every year. It's a good way to catch conditions before they happen and before they go too far. Identifying health concerns early, before they become substantial and long-lasting, is the easiest way to be proactive in managing health risks and risk factors for dementia. For our elderly parents who already have these diseases, if we as the caregiver are proactive and we begin noticing changes in ourselves and we notice changes in our elderly parents, making sure that our parents attend regular doctor appointments, regular health screenings, preventative health screenings, all of that is extremely important in maintaining their health, rather than believing that aging and getting old means that we will all become frail, that we will all become sick, and that many of us will experience memory loss. Life doesn't have to be that way. We'll talk about care forward thinking throughout this program because it is something that I am a firm believer about. I'm a firm believer in prevention and taking care of ourselves. Thank you so much for joining me for this section on midlife health and how it affects cognition. I will see you in the next webinar.